Okay, welcome everyone to this webinar, which we've put on because this is the month that that Burosumab becomes available through the NHS for adults in the UK. And we thought we would share what we have been able to learn about the programme for rollout, but also because there are some people who've obviously been on the clinical trial, there's some experience about what it's like to start on it and what it's like to take it. And we have prepared a fact sheet, which is meant to help people who may be starting on Burosumab for the first time. So, Oliver, next slide, please. So we're going to update you regarding progress towards the new NHS guidelines for UK adults. This is something that Oliver has been working with the clinicians on over the summer to make sure that the NHS application of the NICE guidelines was really clear, and that all the medical staff involved in this programme, could be properly informed about the protocols and the procedures. We'll try and answer some of your questions about starting Burosumab. And as I said, we're recording and publishing this part of the session, so please avoid sharing personal information. Right, next slide, please. So we have produced, as I said, a patient fact sheet, which should be a nice practical walk through what to expect when you start. It covers how to access and administer the treatment and some common questions. And it's now available to download on the XLH UK website. There's a link here, but there's a couple of easy ways to click through to it. One is if you go to the home page, the first call to action says, are you starting on Burosumab as an adult? If so, click here and it will send you straight to this page. Otherwise, this page can be discovered under the treatment chapters. As well as on that page, as well as information, the fact sheet, which you can download. I think it's about 4 pages. It's not terribly long, but it's quite full of information. There's also a link to a video which you might find helpful when you are learning to inject the drug, although you will have help from clinical staff when you first start injecting. The other resource that's there, if you need it, is if you scroll down to the bottom of the page, there is a link to the what we call the manufacturer's drug sheet, which is the one that you will get in your box as well, which is got all the stuff you normally get with medicines in terms of all the disclaimers and a lot of details about the actual drug itself, and also a list of side effects. And just a small point on side effects, it's a reminder that the clinical trials so far have been a small number of trials. And so I suppose for reasons of caution, there's a lot of side effects listed. It appears that the main side effects, which we talk about in the fact sheet, are actually quite minor and often resolve themselves over the first couple of months, especially as doses are adjusted. So please don't be too alarmed by the list of side effects in the drug sheet. We didn't want you, all to be worried if if you read those and felt that was too much. I'm just going to stop there and ask Oliver to just build on that point. Obviously, he's got experience from the clinical trial, and also there may be things I've missed.
Um, yeah, thanks, Sarah. So I think yeah, one on the side effects, I just wanted to also add, there's things there that would occur whether you're on Burosumab or not. So they're also listed. So you might be thinking, oh, Burosumab might cause more dental abscessing, when in actual fact it's the XLH that's causing the dental abscessing, but it was still reported and therefore it still legally has to be in the information sheet for patients. So that's just something to be aware of. But obviously, any kind of questions that you have, their first, first port of call is obviously discuss with your clinician. And if you've got any questions or concerns about any of the symptoms or side effects, just talk to your clinician first, please. Um, of course, goes without saying, that we're here as a community, and you can always, ask questions to the community if you're comfortable, or drop us an email, and one of us will pick it up for you. Um, I guess, but back to the fact sheet. I hope that you all find it very useful. It wasn't just also written by myself and the clinicians, but also it was checked by other patients as well, to ensure that it sort of ticks all the boxes in terms of being easy to understand, easy to digest, and covers all the sort of relevant points that are important for patients. I there is also great appetite among the clinical community to hand these out. So you'll probably find that up and down the country, lots of doctors will be printing versions of this off, and handing them out to patients as and when they are prescribing Burosumab to their patients. Um, so that's great. So they're also very much anticipating this doc. Um,
I was just going to add about
yeah.
there's a section about when Burosumab is not recommended. So they do ask you to come off oral phosphate supplements. So you'll be coming off those at least 7 days before you start your program. And also the guidance now is that there's no evidence about any effect on pregnancy because there's been no tests on it, and therefore it's recommended that if somebody is pregnant or breastfeeding, they don't use Burosumab. The other thing I was going to mention about the fact sheet, which has gone out of my head now, that's great. Sorry, we were so busy writing it, we forgot to rehearse this webinar. Is that there's some frequently asked questions around things like we get quite a lot of questions about if you're traveling or you miss one and that sort of thing. So that's also covered in the fact sheet. It's easy to download, and we hope you'll take a look at it. Let's move on to the next slide, I think. So we've had feedback from different people. Some people, so we had comment back from Wales that Wales is still getting itself organised and probably will not be getting going until January. But we've also heard that some people are being fast-tracked and are being told that they will be able to have it this month or next. So I think there's a variety of speeds at which this is being made available. The good news is that XLH and the clinicians that work on XLH, the specialists, are very much part of the Rare Bone Disease Network. And that's something that we have been collaborating on, because the Rare Bone Disease Network is trying to set itself up into a series of multidisciplinary teams, so that they can make sure that there are centres of excellence which cover all of England and Wales. Scotland and Northern Ireland will probably have, their own systems, but this is progress in terms of trying to coordinate a multidisciplinary team, and means that it's more likely that people in remote areas can access a specialist. And it is important that you see a specialist, because although your GP will be able to refer you for this drug, it will be a specialist that actually approves it and sets you on the right clinical path. So this is the latest slide that I have seen from the Rare Bone Disease Network about how they're trying to set up these networks. It is work in progress. There isn't a final map with individuals' names, but as soon as we have that, we will update on the website the map that we have to try and reflect the names and the locations of the specialist centres. Is there anything else I need to add on that, Oliver?
No, just that there's a lot of clinicians involved in this rare bone disease collaborative network, and it's also the biggest collaborative network that's been put together by the NHS, and there's a lot of drive in this. And also, what's also quite special about this particular network is that XLH is at the forefront, and because it's a medicine that's sort of recently coming out and being used across the country, this is a really great example of the collaborative network working, and something that will be put forward for the NHS, because we hope that the project will continue on for many years and not just be a fleeting decision.
Yeah. And if we could move on to the next slide, I think this is one of the reasons why it's a bit slower, because of course there are a lot of different disciplines involved. And although there will be a lead clinician for the application of Burosumab, it's recognised that XLH touches a lot of different medical disciplines, and you may in your local area be dealing with someone from a different discipline than other hospitals. So each hospital has different specialities. So for this reason, NHS England has been in contact with us and has told us that they are actually preparing communications at the moment, which obviously they'll get us to hopefully see before they go out. But they are in a sense creating an awareness campaign within the NHS, because remembering how big the NHS is, it isn't necessarily true that everyone will instantly know that this is available. And we have had reports that somebody has said, to their doctor, oh well, this is coming, and they say, well, I haven't heard about it yet. So this awareness campaign will be starting shortly, and we are being consulted on it, and we hope that it will be out there raising awareness. I think my current view is that we should give it until January to give them a chance to get themselves organised. But if we get to mid-January and you are still having a challenge with your local doctor denying all knowledge of this or saying that he's never heard about anything, perhaps you could feed that back to us, because we can start to to give the specialists the ammo they need to say we need to raise awareness in this area. But I think give them a little bit longer to get themselves organised, and then in January we'll start collecting areas about if there's any pockets of lack of awareness. Okay, next slide. So the other exciting news, and this is hot off the press as of this morning, is that we have heard that the University of Oxford has been funded to do a 3-year research study on the outcomes of this NHS decision to make it available to all adults. Why is this significant? This is significant because the clinical trials were run with with a set of people who were mostly symptomatic. And because the NHS has said that every adult can have it, whether they are symptomatic or not symptomatic, and regardless of their age, as long as they're over 18, this means that there will now be some people who will be trying it who may have very low symptoms, or who are over, I think 65 is the age considered older. And that then will provide evidence that, which we're all fully expecting, but we have no research evidence, that if you are on Burosumab at a young age before you're very symptomatic, you do not progress to have some of the symptoms that some of the people who have not had Burosumab when they are younger and fitter have. So we're really optimistic that this will be, well, it is always helpful to be the centre of research attention. It's fantastic that the University of Oxford will have a PhD student fully dedicated to the analysis, and that also means that they will have time to work with the clinicians and actually collect the data they need from each hospital, the patient data, in terms of the outcomes. But there is also a real need for us to make sure that some of the non-medical data, so not the blood metrics or the surgery numbers, but some of the quality of life stuff that was so important at influencing NICE, we need to make sure that's captured as well. Now, that won't go through the clinical network. That's not something that the researcher can access through your specialist doctor. That will be accessed through Rudy. And I think almost everyone should know about Rudy, but Rudy is the research platform where we have an opportunity to answer questionnaires about how we're feeling now, how much stiffness are we getting, things that wouldn't be collected by the specialists are collected through Rudy. And it's really important that we keep that properly, fully up to date. And especially now as a baseline before you go on Burosumab, it is a very good idea to update it now so that they've got a before and after. And we also need to encourage as many people who maybe haven't thought about going on it because, they're not that symptomatic. Really important that they go on it as well, so that any differences or improvements in things which are more subtle can be captured. Anything else to say?
Yeah, I mean, just to echo, there's lots of areas that we still don't know about the impact of XLH in certain patient populations. So for one, transitional care is extremely important. So if you have a child that's coming into adulthood, it's critical that they're on this. If you're of an older generation as well, it's also critical that you're on this. Is that there's lots of unanswered questions about how beneficial Burosumab can be for certain patient populations. But any email that you get reminding you to go back to Rudy to complete, please go back in and complete the survey questions. Remember, it's not just a one-off. This is a continuation study. So you'll be reminded to log back in to Rudy and complete your questions again. You might be thinking, oh God, I did this survey last time. It doesn't matter. The whole point is they're trying to measure progress and changes. So that's just important to remember. And if you're not sure of how to get to Rudy, on our website under research and library, it's right there. There's a link to the Rudy study.
It's also on the page with the fact sheet. There's a link to it. the other thing I would say is that as part of trying to make this an easier journey, we've got a little team of XLHers who are advising the researchers how they can sort of simplify the interface with Rudy, and they have also the researchers have promised us that they will help us understand which are the priority questionnaires to fill in, so that, because there's quite a lot of questionnaires, there's about well, there's more than 20, so we're going to be given the top 10 that are really, really important to fill in, and we'll do a big campaign to try and drive people towards those top 10 as soon as they're agreed. Okay, next slide, please. Right, well, this is the last slide. I've got one more thing to say is obviously we're here for you, and we're trying to deal with all the serious stuff of medicines, but we are also a little charity that wants to keep doing fun things like Community Day and other nice things. So we wanted to ask any of you that could, if you're able to support us. One of the ways we thought might be quite fun that you could support us would be doing a Christmas raffle. And to that end, I've got a wonderful helper who is producing a little Christmas raffle cheat sheet as to and has also got sort of flyers and posters and things that you can use as resources if you are able to do a Christmas raffle for us. So we'll do a Facebook about that or a little news item when it's ready. But in the next week or two, we're going to put out a call to say, anyone want to do a Christmas raffle for us? That would be really appreciated.